Have you ever noticed that your hips and femurs might be out of balance? Maybe one femur points a different direction, or you might see that in the mirror as one knee or one foot pointing a different direction than the other foot. Or maybe your hip is forward, one hip is forward of the other. Well, this is going to be a great video to check out. My name is John Clark with the Posture Pain Connection. I'm certified by the Egoscue Institute to perform postural therapy. Today we're talking about an exercise called hip lift. Now it's going to be strengthening your hip flexors and reducing pelvic and hip and femur disparities, but it also can require a lot of strength in the hips. If you don't have enough strength to do the regular exercise, you might need to do assisted hip lift. So be sure to stick around to the end of the video to check out that variation or modification of this hip lift exercise if you have trouble with the first type. One quick note before we get into hip lift: if you are having pain when you try to do this exercise, stop immediately. You should never push through pain with postural therapy. If you're having that pain, check out my card right up here or the description down below for my video about hip and pelvic pain. You should be doing that menu before you get to this exercise if this does cause you pain. Well, you just saw Quinn doing a little bit of downward dog there. But of course, today we're talking about hip lift. So to get into the hip lift position, or into the hip lift stretch or exercise, whatever you would like to call it, we are going to start in the hook lying position. The hook lying position, if you've seen some other videos, you're probably familiar with this, but it's a simple position. We're just sitting. Quinn, Quinn, over here, Quinn. There you go. Oh God. Okay, I'll have to cut all this stuff out. Give me a second here to get the dog under control. We're in this hook lying position, and we just have our knees bent right around 90 degrees. Our palms are facing the ceiling, our arms are at 45 degrees, and from here we're just going to place one ankle on top of the other knee. Now notice I don't have my heel on top of it to where my foot starts to, or my ankle starts to supinate or bend in like that, and I've also not got like my shin or my tibia, my lower leg on the knee. It's right there, the ankle directly above the knee joint. That's an important position here, but the rest of the exercise is pretty simple. We just are going to lift up this leg that was supporting to 90 degrees. And you might want to take a picture of yourself in this position or have someone view you while you're doing it, because a lot of people are going to, especially if you don't have the proper proprioception, the sense of where your body is in space, you might feel like you're at 90 degrees, but you might be closer to like 60, 75 degrees. It's a far stretch up to 90 degrees here. Now this is where the strengthening of the hip flexor comes in. When we get, how do we get into the balancing of the pelvis and the femurs? So here I'm going to push this knee towards or away from my head here towards the opposite wall. So I'm going to push with one knee and pull up to 90 degrees with the other. We're going to be holding for 30 seconds to a minute to the best of your ability. And of course, you always, it's going to be easy to let this other leg kind of relax. The hardest part of this exercise is making sure that you're got this pull on this leg, the push on the other leg. And when you're done, you just go straight down, return to the hook lying position, bring the other ankle on top of that knee, and then we lift up again, because we of course always do what we do on one side on the other side. You always want to make sure you balance out your body this way. If you just do one side constantly, you're going to end up causing way more problems, I promise you that. So again, I would hold this for 30 seconds to a minute. But you know, this, well, it's a simple movement, right? There's not a lot going on like that. You know, it's not repetitive or anything like that. We're just holding this one position. What if you don't have the strength to get this all the way up to 90 degrees? What if you don't have the strength to keep on pushing this out the whole time? Well, that is when we get into what's called the assisted hip lift. I'm going to show you that one as well right now. So what if you don't have that strength to get into the full hip lift position? Well, luckily we have what's called an assisted hip lift position. So here we're going to be using the walls to brace your leg into that 90-degree angle position. So we got to make sure that our butt and hips are far enough away from the wall that our knees are directly above the hips. I don't want to see you so close that your knees are being bunched up to your chest, and you also shouldn't be so far that your knees are closer to the wall than your hips. Should be right at this 90 degree at the hips, 90 degree at the knees. From here, it's the exact same motion. We're going to be putting our ankle on this knee, and we're going to be pushing towards the wall. So we're not getting as much of a strengthening in this position, but this is a good substitute to start with if you can't do the regular hip lift. And then eventually, once you've mastered this position, you can graduate up to that regular hip lift position. Now, one quick thing, the other reason you might want to do this exercise in the assisted position is, what if you can get the knee to 90 degrees, but you don't have the quad strength and this leg hangs down? Or maybe your quads are really tight and this leg wants to shoot up. That would be another reason to do that assisted hip lift position against the wall until you work out those dysfunctions and compensations and get to the regular hip lift position. All right, that's it for hip lift.